Kia ora koutou. Good to see you again. My name is TJ with World Vision, and I hope you and your whānau are doing well and perhaps enjoying some of the newfound freedoms we can enjoy here in New Zealand as we are now in alert level 2. Um, this is another update around our COVID-19 response globally, and I'm sad to have to share news we've been expecting for some time that we've heard on Friday last week of the first confirmed reported cases of COVID-19 in the refugee camps in and around Cox's Bazar in Bangladesh, including the largest refugee camps in the world. I had a chance to visit Cox's Bazar in just March this year, just before COVID-19 and the first cases were really starting to spread in New Zealand. And I had a chance to visit with a number of refugees in the settlements and meet many wonderful people and hear their stories. And World Vision, I can tell you, with your support, is able to do some amazing work there, providing food and food vouchers for almost 100,000 people with, life-sustaining food and rations for them, to providing clean hand washing and access to clean, safe drinking water, to working with women who would otherwise not be able to leave their homes with safe mothers' kitchens where they can cook and learn together. Of course, all this is put at great risk with COVID-19 and the challenges of COVID-19 impacting a refugee settlement like that are immense. Over 1.2 million people living in the refugee camps around Cox's Bazar. Almost the population of Auckland. And people, unfortunately, because of the tight spaces, are living back to back and shoulder to shoulder. We're talking about 10 people living in one room on average of a 3 by 5 meter square space. And so we can imagine with COVID-19 and the impacts of that running rampant, the fears would be. The good news is, with your support, we've been preparing for this day and we're continuing to respond. We've already been able to provide almost 18,000 people with soap and messaging around hand washing and sanitation. We've installed 3,750 hand washing stations in and around the camp. But the impacts for children and families can truly be devastating. You might have heard the story of Minara when we shared an update for you earlier this year around the World Food Program. And to remind you, Minara is a baby girl who was born as her mother and father fled from Myanmar to Bangladesh. So she was born on the way. And so now Minara and her little brother live in the refugee camp. And her father suffers from the risk of kidney failure and other diseases. And we know that he's got a weakened immune system, making him even more vulnerable to COVID-19. And if Minara was to lose a parent or caregiver, she's going to be even at heightened risks living in a refugee camp like that. So this is why, for Minara and many other families, as World Vision now scales up our global response to phase 2, where we're continuing to try and fight the spread of COVID-19 and also address the secondary impacts of vulnerable families around their livelihoods, their healthcare, their food security. It's more critical than ever that we continue to walk together to provide this support. And so we're so grateful for you continuing with us on this journey and helping to bring hope to a world that needs it more now than ever.